history of the family with regard to FAP, as far as my knowledge is concerned, goes back to my grandparents. While they didn't suffer, they had cousins who developed colon cancer, and no one knew why or the reason. I have two siblings. Of the three of us, I was the only one that developed FAP. And I basically went through the normal procedure at the time.
Here we have a father who is affected with a genetic disease, and essentially every cell in his body is affected by this disease, and it's called FAP, or familial adenomatous polyposis. He was at 100% risk of getting colorectal cancer, and he gets married, and he winds up having 3 beautiful daughters.
If the parent has it, there's a 50-50 chance that your children would develop FAP. Alison, when she reached puberty, started developing some kind of symptoms of bleeding. That's when Alison went and got tested, and it turned out that yes, in fact, she did have FAP, and she had several polyps.
I remember about 13 years ago when I came here for the first time to try to decide where I was going to have my first surgery. Met with Dr. Milsom, and he could do what other doctors said was going to be 2 surgeries, an 8-inch incision. He said, well, I can do it in 1 step, and I can do it laparoscopically in 5 little incisions. And that was life-changing. You know, he could do something that nobody else could.
We were pioneering a laparoscopic type of approach for this extensive surgery that's required for familial polyposis.
We were very, very happy, and we thought, we got through this, things are okay, we'll move forward. Until Nicole then was tested and developed it, and then Krista was tested, and Dr. Knoll had to break the news to us that, you know, Krista too had FAP, would undergo the same type of surgeries that her sisters and her father had.
We met Dr. Sonoda, who then did that surgery for my sisters.
So all 3 girls underwent a very large operation at about the age of 15 during a really vulnerable time of their life. And this is a disease where the entire large intestine could be carpeted with adenomatous polyps, which by the age of 40 could turn into cancer in most patients. And so I was involved in the surgical care of Nikki and Krista.
When I went in for my surgery, just going in knowing that I sat with my sister, I watched her go through it, I kind of knew what to expect. When Krista went in for her surgery, like Alison and I were there. That I think has gone a long way for the 3 of us, just to be there for one another.
I remember the first time we met with Dr. Knoll. She had the 5 of us in a conference room. We sat around a table and she said, okay, so what other tests have you guys had? I'm like, well, what do you mean? She's like, you need to go to the thyroid doctor, you need to go to the dermatologist, you need to go here, you need to go there, you need to go retina doctor. We're like, wait, I'm sorry, what? And she's like, there's all these other things that with your disease, you should be monitoring.
We can actually make a huge difference in their lives if we watch them, like hawks, if we really watch them, and we make sure that they are put into surveillance programs, and every year or every 6 months, they're getting some tests done. They will lead normal lives.
Dr. Knoll in particular has allowed my daughters to feel as if long as they follow her rules, her procedures, things will work out well.
And God bless her, because she has kept to her word, and these girls will remind me all the time, Mom, it's time for my scopes. We have to go to New-York-Presbyterian for their checkup and screenings.
Krista and I went, so we had our scopes the same day. We were all just, you know, kind of chatting afterwards, and she had everything down. It was so nice because she knew exactly like what Krista had the last time, was able to compare it, had us that relationship with just Krista, and then was able to go right over to me, had that. So it's very comforting to know that she has each one of us separate and has a relationship with each one of us together.
When we went there, we knew that everything was going to be looked at. Even they had us meet with the genetic counselor that they have there, and sort of looked at our whole family to see if anybody else should be tested.
I think it's very helpful for these individuals to come to a place like New-York-Presbyterian, where they have all the departments that they need in order to stay healthy, where all of their records are in the same system. So me, as the genetic counselor, I can keep track of their thyroid ultrasound, of their colonoscopy, of all of their surgeries, because they're all in the same system.
That's part of our dream, that families with these complex and rare disorders can come to one place and get the multiple experts that they need to make sure that they're well cared for. And I think this family epitomizes that.
That hurts.
It's sensitive.
It's been such a tremendous honor to take care of all 3 girls. I feel like I want to be here for them in the future. There are very few institutions in the world that can provide this level of comprehensive care.
It takes that type of a practice, that type of a program, and New York Presbyterian is actually dedicated to these patients. Our goal is to make sure that they lead normal lives.
So for us, it just feels we go there and it's safe. We know that everything's going to be taken care of, and you can kind of just trust them to take care of your health care.
So I think it's kind of given us comfort and assurance that, you know, we can lead a normal life, whereas before, I don't know if I thought that was possible.
I'm sure people were dropping dead in my family for no apparent reason for generations. And now there's a policy, there are procedures, there's a place we can go that really does do miraculous things. All of these things are, for lack of a better term, a miracle.